Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Joel Gator Warsh, speaking on integrative medicine for children. Dr. Joel Gator Warsh is a board-certified pediatrician in Los Angeles, California, who specializes in integrative medicine. He grew up in Toronto, Canada, and completed a master's degree in Epidemiology and Community Health before earning his medical degree from Thomas Jefferson Medical College. He completed his Pediatric Residency at Children's Hospital of LA and has worked in private practice in Beverly Hills before founding his current practice, Integrative Pediatrics and Medicine, in 2018. Dr. Gator has published research in peer-reviewed journals on topics including childhood injuries, obesity, and physical activity. He has been featured in numerous documentaries, films, podcasts, and articles, including Broken Brain, Dr. Nandy Show, CBS, LA Parent, and many others. He's also the owner of IntegrativePediatrics.com and the host of the Integrative Pediatrics Summit. He's a consultant for high-profile brands in the health and wellness space. Hi, Dr. Joel. Welcome to the show. I'm so excited to have you on today.
Thanks for having me. I'm really excited to be on the show.
Yeah. So this is going to be a really fun episode. We're going to talk about everything integrative medicine related to children. And, my audience, this is really an important topic because we have women that are either pregnant or getting ready to get pregnant or already are mothers and have children. And whether it's a newborn or an older child, we want as mothers the best for our children. And healthcare is paramount for, knowing what decisions we can make regarding that is so important. And what I find is sometimes in traditional allopathic medicine, we don't really get all the choices, right? We don't really have all of the information to be able to make an educated, empowered decision. So that's what I love about integrative medicine.
Mm-hmm. Yeah, no, I agree. And for me, just going back a little bit, so I did all the regular training. I trained at a great allopathic Western program, and I still got a little bit frustrated with the regular system and the really short visits and treating everything with a medication, because that's really what we learn about. And there were so many people that I had heard of or had seen or had friends that went to a natural doctor or a naturopathic doctor or some sort of alternative practitioner, and after going through that for years in the regular system, they go to the natural practitioner and they got better. And that spurred me to say, well, maybe there's a little more, maybe there's some more things that I could learn. And so that's what really pushed me on a path to start learning more in the alternative natural holistic world. And I'm not against Western medicine at all. I think the advancements that we have made are amazing. And, if you get sick and you need an antibiotic of a pneumonia, that's great. We can cure someone that would have died 50 years ago. We can, if you get hurt, you can go to the emergency room and they can get an MRI or an X-ray and you can see things that you can never see before. So that is also great. Nothing wrong with that. But there's so many situations where if you're only trained in pharmaceuticals, which is what you're really trained in medicine, then that's the only option that you have for any symptoms. And the balance and the important thing is to try to tease out, okay, when is something more serious and it is reasonable to do a Western medication versus are there other options available in the natural world where maybe we could do something like chamomile or a tea or a supplement or an herb or something like that could help the patient and avoid ever needing to get to the medication. And so balancing those two things to me is so important, and where I hope that we go in medicine in the long run, because what's the downside of being able to do both?
Correct. You just have more options, and more options, in my opinion, is always a good thing. And it's also, part of it is that fine line, like you mentioned, balancing. If this is life threatening, then, we need to kind of take action, and we can't just wait and see or try something that's natural that might not work as immediate. But a lot of times, especially when we're dealing with any chronic illnesses, there's no there's not an urgency to throw drugs at it. There's an opportunity to actually heal the body and identify root cause, which is awesome. And that's, I think, really where natural medicine shines, right? When we're dealing with chronic illnesses.
I think that's the biggest sphere and the best place to attack it at the beginning, especially because, first of all, with kids and anybody, chronic disease rates are through the roof. They're skyrocketing.
Right.
We know that it's somewhere between 25 to 50% of kids have a chronic disease. Now adults.
That's crazy. That is crazy.
Terrifying.
I mean, can we just talk about why is it so high? Because when you and I were a child, that was not the stat.
Yeah, we don't really know. We don't know exactly why, but my presumption is there's just so many factors at play that are leading to chronic disease. And we're surrounded by so many toxins. We're not
toxins. It's environmental toxins, right? All over.
We're everywhere. I mean, everything that you eat, everything that you touch, every cleaner, everything has such a long list of ingredients these days, and most of them are not that good for you. And people think that everything's been vetted and tested and it's good for human, but a lot of stuff has never even been tested on people and certainly not on kids. And yeah, you take a little bit of it, probably your body can handle it, but we're just so bombarded with chemicals all of the time that I think that that's leading us down the wrong path, down a direction where we're seeing things continually worse and nobody's sounding the alarm on these things. And it's terrifying to think that if you have two children, that one of them is going to have some sort of chronic disease. And when you, as an adult, when you're going to be an adult, you have 50% chance or more of taking a medication every day. That's not normal. And
no, it's not normal.
That's not normal. When we grew up, like you said, I don't remember allergies. I don't remember peanut allergies. I don't remember autism. I don't remember any of these things. And now they're just so common. And I'm sure they were around to some degree, but it certainly wasn't as prevalent as it is now. Every other kid has something right now, and there has to be a reason, and we need to be focusing as we move forward with medicine and health, focusing on wellness and prevention and thinking about these things so that way we can start to decrease those numbers. Yeah.
And that goes back to the root cause. So, we can help identify that in this individual child and address it. But, I think as a community or globally, we could be, ideally more proactive, right? With kind of healing our environment.
Yeah, we can. And I talk about it all the time. I talk about the foundations, or I call them the seeds of health, being S for stress, E for environment and toxins, other E for exercise, D for diet, and then S for sleep. So these are the modifiable, controllable to some degree risk factors that we can deal with every day, and parents have some control over these things. We've forgotten about it. These are just basics. This is not a rocket science. We know that if you're not getting good sleep, then you're not having the time to detoxify your body, and you're going to be more likely to get sick. If you're always stressed, then that's going to increase your inflammation in your body, and it's going to lead to chronic disease. These are things that we know, but we've just forgotten about them because we're so focused on very quick visits, on medications, and we have to go back to the basics and remind people, you have to really think about what you buy and what you eat, because a lot of the food that we have is really crappy. It's just really good, right? And yes. we're just forgetting those things because it's when I grew up, we had craft dinners, so that's, I guess, fine for my kids. But if you look at the ingredients, it used to be like pasta and cheese, and now there's 10,000 ingredients in all these things, and you have the food has changed. And even when you eat healthy, the healthier food for the most part isn't as healthy as it used to be.
Correct. The soil is different.
There's not as many nutrients in the soil. We're harvesting things very quickly in factories and production, so you're not getting the natural life cycle that you need to develop the nutrients in these things. And then you pick it and it travels across the country, and then you eat it 3 days later. So it's not the same thing as eating it off your own tree, your own bush in your own garden. It's just not the same.
Right. No. Yeah. I mean, this is really important for people to think about. And especially when we're talking about children's health and, even with obesity and heart disease and diabetes, we're finding this in children. And a lot of it is very much related to their food that they're eating.
Mm-hmm. It most definitely is. And to me, that's the number one, probably the number one issue with what's going on today is what we're eating. We're not thinking about it. We're just buying processed foods and sugars and dyes and chemicals. And this adds up. It adds up. We're not meant to be eating these things. And when we're eating it on a daily basis, then, there's no wonder that we end up with chronic disease. We are built of what we eat. We are what we eat. Literally, that's what the nutrients are in our body. And if you're eating crappy food, then you're going to that's going to affect your body. It's going to affect your immune system. It's going to affect your cells. It's going to affect everything. And we have to be thinking about that. And there was a really interesting study out of Berkeley where they looked at chemicals in urine, and they changed everyone's diet over to an organic diet for a couple of weeks, and they rechecked it, and the chemicals went down by 90% in the urine. So it's definitely something that can be changed and can make a big difference even in the short term. But we have to be thinking about these things when we're making choices.
We do. And so I'm going to bring you to, I think as adults, we can be conscientious about what we're eating. But I have a 3-year-old son, and he overall eats very healthy, but I know he has sugar in his diet. And so do you have any tidbits for working moms to make feeding your child healthy, like, easy? How do you do it easy?
Easy? No, I don't know if there's an easy feeding a toddler. I have a 1-year-old, and he's actually still pretty good, but he's probably going to soon get to that point where it's not going to be that easy.
A little pickier, yeah.
There is no easy answers. If you get really lucky, maybe you got a kid that eats everything, but most kids are not going to do that. But it's about making better choices every day than you made before, and just thinking about it. You don't have to be perfect. It doesn't mean they never eat any sugar. It doesn't mean you never eat a packaged food. It's just about making small improvements here and there wherever you can. Buying food that is healthier tends to be a little bit more expensive. So you can still eat healthy, and it doesn't have to be so expensive, but it tends to be a little bit more expensive. So you have to do whatever you can.
It's an investment in your health.
Right, exactly. It's an investment in your health, but you need to make the choices wherever you can, because even small differences can make a difference in a child. And if you're getting them chips, well, then there are better versions of chips you can get. You can make smaller changes like that. And you really have to work with each kid and see where they are. There are lots of healthy options that most kids will eat. And if you expand out and try to find other things and experiment, then hopefully you can find a few dishes that they like, find textures that they like, find flavors that they like. And even if they don't like a certain vegetable, maybe you can combine it with a sauce or something else, and maybe you can get them to like it. Or maybe they don't like that thing. That's fine. Just go on to the next thing and keep trying. And don't get too frustrated, because every kid is picky around 2 years old or 3 years old. That's normal. So you just keep trying. You keep putting things on their plate, asking them to take one bite, making a smoothie, putting things in smoothies. There are a lot of ways to sneak things in or get things in. And you don't need a ton of it, but at least you get a little. And that's
right. Yeah, I think, and the other thing too, I had interviewed another pediatrician where, if they say no, you just offer it again, like maybe a week later. Like, in other words, you don't give up on that food. You just try it again after a little break, and eventually they're going to say yes.
Yeah, hopefully. And the reality is that most kids are not going to go hungry. And sometimes we have to be a little tough on our kids and just keep trying these things, because they only eat, especially at that age when you're not around other kids so much, they only eat whatever you have at home. And if you don't have junk food, then they're not even going to know that it exists, and they're not going to eat it. But if it's there and you offer it, then that's what they're going to probably prefer, because it's sugary and it gives you the endorphin highs and those kind of things. So number one, you just got to try not to offer it. And number two, just be persistent with it, because they're going to eat it eventually. They're not going to go hungry for the most part. I mean, some kids are really tough, but in general, most kids are not going to go hungry. They're going to eat it, but you have to be reasonable. You have to be
tough.
You got to be tough, but you also have to be reasonable to their level, because you can't expect every kid to like broccoli or every kid to like peas or whatever it is. So you have to give them options so that they can have healthy options, but that are reasonable, that they like, and that tends to help people is options, but reasonable options.
I find too that whatever I'm eating, assuming it's not like too spicy, my son wants to eat it. Like, he doesn't even know what it is. So he wants to sit in my lap and eat it. So I think that's the other thing that encourages me to really model literally in front of him, because he's going to sit on my lap and ask for a bite, and then another bite, and then maybe another bite, and eat half my breakfast.
No question. You hit the nail on the head. You have to model the behavior that you want, especially as the kids get older. You get into the teen years or the older kids. If you're eating chips and cupcakes and cookies and that's what's around in your house, then how can you expect them not to eat it? If you're eating, quote unquote healthy, and you're having veggies for your snack, and that's what you offer them, then you're gonna be much more likely to succeed if that's what you're doing, versus you're eating chips and then you're saying, hey, eat some cucumbers. Well, they're gonna be like, well, but you're not. right? That's just
Right.
logical child. So you have to be fair and reasonable and model good behavior for them. And if you do, then you're way more likely to be successful.
And I think in general, it's just easier to make better decisions for adults and children when you don't have the junk in the house, right? So, just really like kind of cleaning anything out that's not really healthy, and ideally just stocking your pantry and fridge with healthy foods.
It's so important to do that. And most people, when they're at the bottom of the mountain, they think it's such a high task. It's such an impossible task to actually climb the mountain and get your kids or your whole family to eat healthy. But you don't have to do it all in one step. You do it and you take a few steps and you get rid of some things and you replace them with other things. But it is possible. And when you do it, yes, if your kids are going to rebel, especially if they're older, they're going to be unhappy. They might not eat as much for a few days, and that's fine. But usually what you will see if you hang in there for yourself or for your kids is if you can get past that point of all the cravings, then you start to not really want that food anymore and you start to enjoy the other food more. Your body and your palate changes. And then when you're eating the sugary, chemically food, then you think it's gross. And that happens all the time, people. You see it all the time. But you have to give your body that chance to change over, because you get used to what you're eating. Your body gets used to the sugar, it gets used to the chemicals, and it handles it. But once you get rid of them out of your body, then when you reintroduce them, then you start to really feel it. And then you're like, oh, wow, I don't feel good. I don't want that. And that happens a lot of times where if you as a parent do it first, you realize, what you go through, and then the kids go through something very similar, and they can do it. I've seen it over and over and over again. It's not easy, but it is doable.
Yeah. And I think it just requires a little bit of persistence and commitment, right, to make that shift. And, I've watched documentaries on how addictive sugar is. It's like morphine, right, to our brain. So, you can see why, especially like kids' foods that are packaged, they have the Paw Patrol and all those fun characters. And like, if I take my son to the store, he's like, buy that, right? Because it looks cool. And he wants to have a Paw Patrol waffle. But I know it's just a bunch of chemicals. And when you're buying these foods that are marketed towards children, that are packaged, they're loaded with sugar, and these kids are not only having that palate, taste for sugar, but then their brain is actually craving and addicted to more sugar. This is like a detox.
It absolutely is a detox, and it takes, a couple weeks probably from when you start to when you get to a point where you don't feel like you really need it anymore, but you have to get it out of the house. If it's there, you're always going to choose the snacks. It's just we're wired that way, and we have done it for so long. And it's marketing. We were marketed to as kids and now as parents a certain way to eat, and we just need to start making those changes again. And if you look at it, just like you're saying, the fancy packaged boxes, well, they're fancily packaged because they don't want you to look at the label.
Right. They don't want you to look at the ingredients.
Yeah. You have to. That's like maybe my number one tip to families is you have to read the labels. You got to read the labels on everything you eat, and everything you put on your body, and everything you put in your home. You have to start getting in the habit of reading the labels. If you look at food product and it says cranberries and cashews and almonds, it's probably going to be decently okay for you. If you have tetramethyl hexa, whatever, if you don't even know what it is, it's probably not going to be a good idea to put that in your body or on your body or in your house. And once you start to think in that way, then when you go to the store and you make purchases, you start looking at things, and there are better options. There are better options, not always more expensive. Sometimes it's less expensive. Sometimes you can, for cleaning products, you could just get vinegar and water or baking soda, and that will do just as good a job.
And essential oils.
Exactly. You can do those kinds of things. And, for your just general floor clean or a little spill, you don't need to use the 99% bacterial killing whatever spray, but also there's 10,000 other chemicals on there. And if you just make those small changes, then every little bit helps overall, and every little bit can lead to a healthier family versus every little thing that you're doing making them a little bit more sick.
Correct. And even as you're talking about chemicals like for cleaning the house, or let's talk about cleaning our bodies and hand sanitizers and what that's doing to our microbiome.
Mm-hmm. Yeah, and it's an interesting time with all this stuff, with hand sanitizers and cleaning. I think like anything else, over the long run, we're going to realize that everything that's very chemically probably causes many more issues than we really realize. I don't think if you use a hand sanitizer one time, is it going to cause a major issue? Probably not, unless you're allergic to it. But over the long run, sure, it's going to. These things, your skin's an
Several
organ.
times a day.
Yeah, and if you're doing hand sanitizer with alcohol and all these things 50 times a day, then that's going to lead to some effect, maybe just a skin rash, but it's going to irritate you, as opposed to just a nice soap that's
Washing your hands. Yeah.
So there, you have to balance too, because obviously with everything going on, we want to make sure that we're safe too. So there is a balance, and nothing is just one side or the other. But it all comes back to balance. If you need to use a hand sanitizer once or twice because you're touching something dirty or out in public with everything going on, sure, you do what you got to do. But choose the more natural product as often as you can, because it's your body can handle some degree of chemical and toxins. It can handle some of them, right? Usually for most people. So you want to minimize what you become exposed to. So that way you give your body the best chance to handle the things that you can't control.
That's right. And so, Dr. Joel, when you have kids in your office that come in with a chronic diagnosis, what do you do to help support their body in healing?
So that's a big question. It's a good question. It really would depend on the child and the age. Every diagnosis is different. Every child is different. But things that would be common to all that would be, number one, discussion. You have to have a good history. You got to discuss going back in time and trying to figure out if there was any triggers or points in time where things might have started, or things that maybe no one ever thought of as could be contributors to it. You got to get a really good diet history, because diet tends to be related to almost everything these days. And then you have to go through the modifiable risk factors, see if there are things in their life that you can change, see if there are ways that you can decrease inflammation. And that's usually a good place to start for everything. You want to go through those things. You want to, as a physician, I always want to make sure I rule out medical causes. So if they're, if we're talking about like ADHD or autism or other diagnoses that kids might come in with, I think you want to go back to the drawing board, and you want to think, okay, is there any other things that are somewhat similar to this that maybe somebody didn't pick up? Maybe they didn't do lead testing, or maybe they didn't check their vitamin levels, or who knows what. There's so many things that it could be. But depending on what the situation is, you want to make sure you rule out the medical causes. So you do that first, maybe some general blood work, and then you see where things go. Maybe you advise them on supplement protocols, or maybe you do more testing, more advanced testing and nutrition testing. It just depends. I mean, you have to talk to each patient and get a feel for where they are, what the problem is, and then where you feel there is the most likely to be an imbalance. Is it in their gut, and you do stool testing? Is it you feel like they were exposed to chemicals? Maybe they had a lead exposure in their home, or maybe there's some chemical or a mold in their exposure. Maybe there's food allergies, so you do food allergy testing or food sensitivity testing. There's so many options of where you can go, and it really the history, what you discuss, really guides you as to what are the most likely contributors, and so you do one thing at a time to try to figure out. But there's a big difference between testing with adults and kids too, because you don't want to do too much blood work. You don't want to do too much testing. It's not fun to get kids to do blood work. So that you have to balance how bad the problem is with how much you want to do, and then that's where, again, each kid is different, because if something is more severe, then maybe parents will want to do more, versus if it's not that severe, you might not want to do that much. And it depends what you've done before as well.
Yeah. And I think what I'm hearing is anybody coming in with a chronic condition, diet is like paramount. So like not only just getting the junk out of their diet, but if there is a food sensitivity, and maybe they haven't done the blood work yet, even just doing like a modified elimination diet, taking out the common allergenic foods to see if there's any improvement in their symptoms.
Yeah. The most bang for your buck right now, almost any integrative doctor you would ask is dealing with diet. I mean, especially gluten and dairy are the two biggest contributors. We see so much improvement for kids, if they get off of these things, that they are sensitive to them. So many times the first step while you're waiting, so like, maybe a patient comes in the first time and we're having this discussion, and maybe there's some appearance that there could be some diet issues. So then the elimination diet, just like you said, is a great place to start. Like, hey, I think that maybe gluten could be a contributor. So let's take that out for a couple of weeks from your diet. You don't have to never do it again in your life, but let's just take it out for a few weeks if you're open to that. And then you put it back in for a couple of days and see if you notice an improvement and then a worsening when you do it. And then you don't need a test. I mean, if symptoms go away and then you put a bunch of wheat back in and you get all of your symptoms back again, you have your answer. You don't need to do any blood work. And that's always
Right.
for kids. And that's often what we'll do first, because we always try to avoid testing.
Yeah, that makes a lot of sense. Now, I have a question. I'm dealing with screen time balance. And I know I don't even have a child in virtual school, but what about, we have virtual school going on, and then beyond that, like iPad, babysitting, TV time. I mean, how do parents balance this? It's very hard.
It's one of the most difficult issues right now with everything going on for pediatricians. So I mean, there's everything going on with in the world right now, but one of the most difficult things is that we have for years said we got to decrease that screen time. We got to decrease the screen time. We want to get kids off of the screens. But with the pandemic, it's you have to choose the worst of evils, and we want people to be connected. You got to do your schoolwork. And so you have to do what you need to do. So the reality is you want to try to minimize screen time as much as you can, but at the same time, we want to keep kids connected. And so you just really have to balance that. I don't think the general recommendations apply so much right now when you kind of have to be on the screens. So to me, it's better to be connected and better to be talking to friends and being and staying connected for the moment. And then hopefully, as things start to improve, then we can make sure we're decreasing our screen time significantly and spending extra time off of those screens. So yeah, it's a tough one.
What were the guidelines pre-COVID with screen time?
The general guidance, depends what you read, but most people would say like 1 to 2 hours a day of screen time is pretty typical. So it's not zero. Everyone's different, and a lot of times I get questions from parents on like, when should I start screens? How much screens when you want to be minimal when they're little, but we also live in a digital world. And so I think you need to be reasonable, and you're not going to have probably zero screen time unless you don't have screens at home. So they're going to see some things. And I also think it's very, very reasonable if you're, on a trip and you're driving somewhere to use a movie, or you're on a plane. I think that's fine. There are times where, it is very beneficial for everyone, including everybody around you, to keep.
Everybody benefits.
Yeah, everybody wins in that scenario. But
if you're out for dinner and you're going to have a moment to talk to your spouse.
To me, when people ask the question, I say, you shouldn't be using screens to replace parenting, right? You shouldn't be using screens to, you go home in that evening and you're a little tired and you're like, okay, watch a movie for 4 hours. I don't think that's a good idea, but I think every now and again, it's fine. There's lots of good programs that are educational, whether it's on an iPad or on the TV or on the phone, whatever it is. There's so many good things there too. So it depends what you're doing and for what reason. So I don't think zero screen time is fair or reasonable. And that just makes parents feel bad because nobody's going to have their kids really on zero screen time for the most part. So I think everything comes back to balance, right? Everything comes back to balance. A little bit is probably fine. The more you do, the more you could run into problems, and every kid's different, but you shouldn't be relying on screen time for your most of your parenting day.
Do you have any specific educational programs that you recommend?
I mean, nothing specific. I mean, it depends on what age, what kid, but I think that there's some great like yoga, meditation apps for kids out there. There's, great learning tools and tips. There's all sorts of toys that you learn the alphabet and they sing songs. So I don't know if I have one specific one because it's so age dependent, but anything that is educationally based instead of just being super passive and just watching a TV show, I think that is much better for them in general. And they do have to learn how to be on screens. I mean, the world is on screens. So they're going to have to handle that as a teenager and as an adult, or whatever the future technology is by that point.
Mm-hmm. Well, what else do you have to share with us?
I think with the pandemic, I mean, I think it's, I don't know if you have any questions specific to the pandemic, but
yes, tell us.
A lot of what I mentioned, before with the foundations rings true with the pandemic too.
Just boosting your immune system.
The number one question I'm getting these days is about, how do I keep my immune system strong? How do I keep my family's immune system strong? What can I do? And there's obviously, everywhere you are in the world, there's different recommendations in government and local. So, follow whatever, is going on locally, because every place is a little bit different. But what is frustrating as an integrative practitioner is that what you don't hear that frequently is what you can actually do for yourself and your family. And there are things that you absolutely can do to strengthen your immune system, keep it as strong as possible, and to either, prevent or at least decrease your risk of getting sick or getting very sick if you contract anything. It doesn't matter whether it's a pandemic. This goes true for every virus and every bacterial infection that there is. The stronger your immune system is, obviously, the better. And there are things that we can do. And those things are the seeds. Those are the foundations. We know that if you don't sleep well, then you're way higher risk. You have a way higher risk of getting sick. Cohen did the landmark studies back in the late 90s and early 2000s, where he put viruses in people's noses, and had one group of people that sleep deprived and one group that wasn't, and he had one group of people that was stressed and one group that wasn't. And I don't know who was volunteering to have viruses put in their noses, but they did it.
And be stressed at the same time.
So you're stressed and you're getting a virus in your nose, but all sorts of things for science.
They must have gotten paid well.
They probably got paid pretty well to have viruses in their nose. I don't know. Probably not as well as you would have hoped, but they probably got paid.
Right.
They probably got paid decently, at least. You see that they get 3 times or 5. They're just more likely to get sick if you're in the group that's more stressed, doesn't sleep as well, exposed to more toxins. We know these things. So if you are going to be exposed to any virus, what can you do is you can keep your body healthy before you're exposed. And you do that by eating healthy and sleeping and getting exercise and getting vitamin D and trying to keep your stress level down. And with stress, we're surrounded by the pandemic over and over again. Every message, every Instagram.
Yeah, there's a lot of fear out there.
Fear. And there's, in some ways, good reason for some of that fear, but there's also a lot more fear than there needs to be. And social media has really amplified all of that fear because we get exposure to these things on a constant chronic basis, and you have to be really cognizant to shut it off. You have to be really cognizant to know that these things are stressing you out, and you have to be able and willing for yourself and your family to turn off the phone, turn off the Instagram, give yourself little mini vacations. Say, I'm not gonna be on my phone from 5 o'clock to 6 o'clock. When we're going to have family dinner, nobody has their phones on. There's no checking. You don't have to never see your phone again, but you can do little things here or there. So at least you have an hour where you're not stressed, or plan in an hour, you're going to go gardening outside, or you're going to go for a walk, or you're going to do whatever just to get your mind off of everything going on, because there's nothing worse for getting sick than being stressed about getting sick.
Right. I mean, I would say that when people have so much fear around COVID, they're literally lowering their immune system and making themselves more predisposed.
Of course you are. And it doesn't mean don't be cognizant and don't be informed. There's a big difference. There's a difference between having an understanding of what's going on and being aware of the situation and being aware of the rules and being aware of what you can do to minimize your risk, from that to being stressed. If you're stressed all the time, if you're worried about it, if you're worried, you're going to die, your kids are going to die, your family's going to die, everything's going to be horrible, the world's going to end. If this is the kind of talk that you have with yourself all the time, that's going to be the biggest contributor to you actually getting really sick if you do get sick. We know that, and it's easier said than done. Absolutely. It's not easy not to be stressed about everything going on. Everybody is. But
right.
You don't have to be 0% stressed, but if you're always stressed, try to be 90% stressed. And that will, right? It's all about minimal changes, but those little things can make a huge difference. Even if you have an hour a day where you go for a long hike, that's going to matter to your body.
Well, and let's talk about the science. When kids are getting exposed to COVID and testing positive, in general, they've been recovering extremely well.
Correct. Most kids do very, very well. Most people do very, very well in general.
Correct. The whole general population, and that is overall healthy.
Right. It's definitely a deadly disease. It's definitely not fun. You definitely don't want it. But it's not, the same thing with every, if you get the flu, some people get really sick and some people unfortunately die. And that always happens. And with coronavirus, that's no different. We've had coronavirus around in the world for generations. It's not a new virus. This version of it is different, but these things
right.
are around, and there are lots of diseases around the world that kill people, and we don't want anybody to die ever, right? But these things do happen, and so we want to be mindful of it and do all that we can as a society to keep those keep our risks down to a minimum. But most people that get it do just fine. The younger you are overall, the better that you are likely to do. Kids, for the most part, don't have any symptoms or asymptomatic, or they have very mild symptoms like cough, cold, runny nose. Could you get really sick? Absolutely. It's very, very rare. I haven't even had any patients in my practice at all that have been very sick from it, but you certainly read about it. I know other doctors that have had some patients that got pretty sick.
That had to go to the hospital.
So it does happen, but it's very rare, very rare.
Yeah. And I think that's important because in general, I know, especially as moms, like they're more worried about their child's health and their own health. And, if a lot of your stress is about, oh my God, I don't want my child to get exposed. I think the reality is that we're all probably going to get exposed eventually. And especially for kids, if you're practicing the seeds and your healthy lifestyle, then you're going to be okay.
Exactly. I mean, for the most part, you're going to be okay. We've been through pandemics before, and we've been through all sorts of things before, and we always come out the other side. Humans are tough, and there's lots of intelligent people out there, and they're doing lots of great things, and lots of people have had it, and they do just fine. And so, you have to be, again, conscious and cognizant, and don't do something silly. And, I tell people always as a joke, like, don't go licking doorknobs if somebody, just has coronavirus. It's not, you don't want to be cavalier about it, right? But
right.
You can't sit around all day and just be fearful of something, because that will create the problem that you fear most. And you have to look at the statistics and understand the level of fear that you have to have, especially for your kids. And exactly what, parents are always more afraid for their kids. And now every sniffle, every cough, every single thing, as soon as you get it or your kids get it, you're like, oh my God, is this coronavirus? This is
right. And it's probably just a common cold. And
it's probably, all the other stuff is still around. So you have to, again, be cognizant of it. If you're worried, you talk to your doctor, you get tested, you do whatever you got to do. But just because you have a cough or a sniffle doesn't mean that, everything's going to spiral down into horrible things. It's just we've been exposed to a constant stream of horrible things, and we see the horrible case in Hawaii, and we see the horrible case in Australia, and the horrible case here, and we're bombarded with the worst scenario,
right?
And it's not,
which are luckily very rare, right? Is what you're saying?
Yes, it's much more on the rare end to have super horrible side effects and those things that happens, but it's that's just here because the media is sensationalistic, and we hear the worst stories, and good and bad, right? You want to be cognizant of it, and we want to be careful, but you have to understand that what you're exposed to is the worst of the worst, and you're also not hearing many of the best stories. The kid that is totally fine, the family that helped the other person get over it, the family that helped the old grandmother who was sick with COVID, they brought their food. You don't hear that story much anymore. You just hear about the horrible things. It's tough. It's tough on people. People are sadder than they've ever been.
Yeah. Let's talk about the mental health component here for families.
Sure. Yeah, I think that may be the most important thing right now going on with and the other side of obviously the pandemic is the disease, but then there's also the mental health side of it, and that is the thing that I think it's starting to be talked about a little bit more, but it's not being talked about nearly enough, because the rates of mental health disease, so depression, anxiety, high levels of stress, it's through the roof. I mean, it's more than anything we've probably ever seen before, certainly in our lifetimes. And
right.
In my office, I've never seen people as sad as they are these days. Because everybody thinks that they're alone in this. They think that I should be stronger. I should be this. I should be that. Whatever. They don't see that every other person is also stressed. Every other person,
right? We're all stressed.
Every other person is also missing their friends. Every other person is also missing everybody's going through this, and as a doctor,
we're all like grieving losses.
Yeah, and people have lost family members, and they've lost friends. There's all sorts of things going on that are reasonably sad, but we feel alone, but we're actually not alone. And as a physician, I get to see how not alone we are, because I see every person that comes in, but they all feel the same way. And you have to know that we're alone together in this, in a way. Everybody is feeling that way, and you have to take that into account and do whatever you can to make sure that you're doing okay, and reach out to somebody if you're not, because it's a very tough time. It's been a year. It's been a year of for a lot of people being more alone, being isolated, maybe losing friends and family. Maybe you had a cousin, or you have a grandchild that you've never seen in person, or all these things. This weighs on people. It's tough.
Yeah.
And you have to acknowledge that. And and it's just not an easy thing to deal with.
So what do you recommend for kids? I mean, how you balance the social distancing, but with it, how especially younger kids or really even teenagers need to be social, right? I mean, we're all social creatures. Like, how do we do that from a social distance perspective?
I think most people, at least at first, have been, doing the online stuff, which I think is super important. You got to reach out to people, at least speak to your friends as much as you can. A lot of people have done pods. So I think that,
Yeah, the pods are huge, right?
yeah, within reason and within safety, and it depends on where you are and how bad the cases are and all these things and what the rules are. But for the most part, two kids hanging out is not going to be extraordinarily dangerous, but it's going to be much better for their mental health. So it's very different than going to a party and being around 500 people versus two kids that see each other every day. Well, is there a little risk? Sure, there is a little bit of risk, but everything in life has a little bit of risk, and you got to balance the two things. But if you have a depressed child, well, the depression might be worse for you than it will be for them to hang out with their one friend that you guys all got tested and everybody's negative and you pod in together. And you have to balance it out. There's no one right answer. It's a very controversial thing, I would say. But at least personally, I think you have to weigh the risks and you have to know your own kid. And some kids are totally fine and thriving and love being alone and love not having to go to school, and other kids are miserable. And
right.
Your own kid.
Different personalities, right?
Yeah, and see within reason and within whatever you can do to be as safe as you can to figure out a solution where you compromise. It's this balance again, and you compromise, and maybe it's around one kid or just two kids, or you have a family member that you really trust that they have a cousin that's like the same age and they can play together. There are things that you can do within reason that would be of minimal risk to everybody.
Yeah, and I do think that the socio-emotional learning is just so important, and you just for younger kids, especially like a toddler, you can't do that virtually. Right. You can't learn how to share and be kind to others.
Right, and the good news again is that the younger kids are lower likelihood to get really sick from it. So the concern again is that the kid gets it, but they don't have symptoms, and they pass it to mom, it passes it to grandma. So you have to be careful.
So that's the problem, right, with older people. They favor carriers.
But there's also a reasonableness to life, and we have to have some balance somewhere on, you're going to have the lowest risk if you move to the middle of the forest and you don't see anyone ever again, but that's not necessarily realistic for people either, right? So you have to balance the two, and we have to remember that mental health is just as important as physical health, and so we have to continue to balance these things, and hopefully as in the next few months, hopefully the cases will drop and things will start to improve over time, and then we can start to prioritize a little bit more of the mental health and getting together in smaller groups and trying to get back to where we were. But right now it's tough. I mean, LA, it's really tough. We have a really high case count right now here, and things are not going in a good direction for the moment. So it just depends, where you are and what's going on. But everything has consequences, and so everyone has to do what they need to do. But you also need to be mindful of other people. So you have to balance those two things.
Yeah. Yeah, it's tough. And I mean, unfortunately, there's not even like a finite deadline of like, okay, we can wrap this all up, in May. And, I think people are like, oh, I just need to know how longer. And it's like, no, that's unknown.
Right. That's one of the toughest things for humans, I think, is an unknown situation. And if
uncertainty, right?
You know what? Coronavirus is going to be over in March, and until then, you're going to stay in your home and you're never going to see anybody. But after March, everything's going to go back to normal. I think most people would be fine. But
yes,
they wouldn't like it, but they'd be fine. But it's just
right.
An unknown of, well, I'm doing this, but I don't even know if this is ever going to go away. Maybe I'm going to be maybe I'm never going to see my grandkid. Maybe this is going to be 3 years. Maybe it's going to be 5 years. Maybe, it's just the unknown. So you have this, at least for me, you have this constant back and forth of how should I be more scared? Should I be less scared? Should I be just being like, what, I want to go see my cousin. I want to go see my aunt, or should I be a good, citizen and just stay home and not do, like, there's this just constant battle in your mind of, well, because you don't know, you're just weighing everything, and the information changes every day, and the research changes every day, and
right. There's so many unknowns, and nobody has the answer, right? Even the top experts,
right? And everybody has a different opinion, and everyone has a different situation, and so it's a constant mental internal battle of what you should be doing, and without having a known endpoint, it exacerbates every single one of the problems, because you're like, oh, I can wait for another month to see my cousin. But then you're like, well, what, I have to wait for 2 more years? That,
Right.
it's a hard internal discussion to have with no exact answer.
Yeah, it's really hard. And I think I really appreciate that you hit it on the head, that this is not just like one person going through this. Like this is global. Like it's not even, this is an American thing. This is a global thing.
It's definitely a global thing. I mean, some countries are more hardcore than America. So
right.
There are places that are doing more things than we are, and some places are doing less. But it just depends on where you are. But it's absolutely a global thing. Everybody's been through it. Everybody has their own struggles and their own country rules and their own reality. But nobody's having a great time right now.
No. Awesome. Well, Dr. Joel, do you have any last thoughts you want to share with the audience?
No, I just want to, wish everybody, stay healthy and really think about your mental health. Focus on the seeds. If you're going to, get one takeaway from this, it's just really focus on those modifiable risk factors, the seeds, which you can work on with your family, make some small changes, and feel free to reach out if you have more questions. You can find me at integrativepediatrics.com or at Dr. Joel Gator on Instagram, and you can reach out and talk to your practitioner absolutely about these things, and just try to make small changes. It will make a big difference. I see it every day.
Awesome. Thank you so much for coming on today.
Thanks for having me.
Well, that was a fun interview I got to have with Dr. Gator. He's a wealth of information regarding integrative medicine, and I love how he just boils it down to the simplicity of basic lifestyle that can benefit the entire family in feeling vibrant, healthy, and having strong immune system with the seeds. So this is all good information and habits for us to practice to stay healthy and safe during a pandemic, as well as the rest of our lives, and creating really healthy lifestyle habits for our children. And I also want to let you know that my online program, Brayton Birth Method, has gone live. Check it out at drlaurabrayton.com. We're looking for preconception women that are looking to make holistic, healthy lifestyle choices so that they can consciously prepare for conception, healthy pregnancy, and an empowered birth experience.